Hey guys, Dr. Marcus here at Alvarado Healthcare, here with my sister Alicia. She's 29 weeks pregnant. So what we've been doing here is what's called Webster technique, treating her here in the office. So this is a special technique developed specifically for pregnant women. It's a very delicate technique used, and I'm going to show you how the treatment goes. So I'll have you lay face down for me. So we had a lot of questions about people curious about this technique and how it could help them. So this technique doesn't involve any popping or twisting. It's very delicate, slow motions used to treat the body. So during pregnancy, there's a lot of changes going on with the body. There's ligaments that are becoming very lax, muscles that are having to work harder than they typically do, plus that anterior load that you're having that's going to put a lot of stress on the low back and the pelvis. So a lot of people experience low back pain, hip pain, sciatic-like symptoms. And just to let you know, these things are not normal. They might be common, but they're not normal. So here in the office, what we do is a variety of different things to treat that. So first what we're going to do is just a very slow, delicate treatment for the low back. So what we're going to do is just delicately press on some of the muscles as we lower the table. So what this is going to do is stretch out some of those really tight muscles of the low back. And as you can see, it's very comfortable for my sister, the patient. Belly is here in the stomach, in the pillow, so we can just delicately stretch out these muscles. Now in this position, we can also go side to side. Very slow, controlled movements, so no twisting, no popping, anything like that. So we're just going to mobilize the joints very delicately and then loosen up the muscles as well in this position. And then what we can also do from this position is use a soft tissue mobilization tool to work out some of those muscles in the hips. So while she's laying here, all we're doing is just loosen up those muscle fibers, just very delicately. The patient, will actually feel pretty comfortable because these muscles that are so tight and constricted want to relax. So what we can do is we're going to work on the muscles of the hip, including the piriformis and the glute. We're also going to work on the hamstrings. Hamstrings attach to the pelvis and are going to pull it in certain directions. So loosening that up as well, and we can incorporate some leg motions, which is going to get a little extra, more efficient stretch. Just like that. Very good. And then after working that, we're going to turn the patient over. So, can I have you go onto your back, please? There are tissues on both sides of the body that we want to treat. There's a lot of problem areas, so we want to make sure we address them all. So I'll have the patient go onto the back. We'll raise the table up. And then next we want to work some of the muscles of the front of the belly. So there are two ligaments in the front that can be very problematic during pregnancy called the round ligament. They're on each side and they help carry the baby center in the middle of the stomach here in the uterus. So what we're going to do is apply pressure to that ligament and just release it. So all we do is find which side is tight just by using our thumbs, and then we just apply a light pressure. And what this will help is keep the baby more centered as opposed to one side or the other side, which can if the weight is not evenly distributed, you can have a lot of problems there as well. How's that feel? Okay. So just applying a light pressure, then we relax. And then one of the last things that I would look at is the hip flexors. Both sides, those are gonna flex the hip just in this motion here. So finding which side is a little tighter. And then all we would do is just apply our thumb onto the muscle and delicate, slow stretch here. And we work all the way down the muscle belly, just releasing all the trigger points and making sure that muscle can function properly. So as you can see, it's very delicate treatment here. It's very, very helpful. Like I said, this technique was developed for treatment of pregnant women. So it's very light, very delicate for the patient and for the baby. So if you have any questions or you are having some pain with this, feel free to reach out to us. We'd be more than happy to help you.